Hello, I'm Dr. William Berger, physician, owner, founder of Northeast Medical Practice. We are a primary care, weight management, and aesthetic medicine practice located in Great Neck, New York on Long Island. So today I'd like to take a moment to speak about some of the most newsworthy medicines in the realm of weight management these days. These are Wegovy and Zepbound. So I want to talk a little bit about where they come from, how they were developed, who can take them, how they work, side effects and things like this. Because very often I have patients coming to my office with weight issues, and this is one of the things that they're very interested in. I will preface the talk by saying that here I focus on a holistic approach to weight, meaning that we focus on lifestyle and we utilize medicines as needed. But the lifestyle modifications, things dealing with diet and nutrition, exercise, sleep, very important and often not considered or underrated in its importance, stress, very similar, changing our behaviors with health coaching, avoiding risky substances, and in general focusing on a healthy lifestyle that involves social connections, and all of the things I just mentioned. This should be the foundation, the underpinning of everybody's approach to their health, whether we're considering a weight issue or not. But today I would like to talk about two of the medicines in particular because they are in the news so often. There are a lot of misconceptions about them. So let's talk about Wegovy first. So Wegovy is the brand name version of FDA approved for weight loss of a medication called semaglutide. Semaglutide is also the active ingredient in Ozempic. So Ozempic is the FDA approved version of semaglutide for diabetic patients. But today we're going to talk about Wegovy because that is the one used for managing people's weight. But as you may have surmised here, originally these medicines were developed as diabetes treatments. So they are what are called incretins. That means they increase insulin secretion from the pancreas. And in that way, they help with managing blood sugar and controlling and treating diabetes. So semaglutide was originally developed as a diabetes medicine, first FDA approved as a diabetic treatment, and then FDA approved for weight loss. Because one of the secondary effects of semaglutide, either as Ozempic or Wegovy, is weight loss. So how does it work? Well, first of all, it does not burn fat. It decreases your appetite, and it does that in two different ways. So the technical term for semaglutide in medicine similar to it is a GLP-1 receptor agonist. So there is a hormone in the body called glucagon-like peptide 1, or GLP-1, and it has a receptor that it interacts with. The receptor for it, the GLP-1 receptor, is located both in the gut and in the hypothalamus of the brain. So I know this is a lot of medical jargon, but what we're doing here by stimulating that receptor with a medication is basically taking into account and maximizing what this natural hormone should be doing in the body. Now, GLP-1, paradoxically, it's supposed to go up when you are full, it's supposed to go up when you gain weight, but in folks who have significant enough obesity and or diabetes, paradoxically the opposite thing happens, and GLP-1 is naturally not secreted in the amounts that we would like. Because the things that this hormone does in the gut, it slows down gastric emptying, so you literally stay full for a longer period of time. In the brain, it interacts with receptors in the hypothalamus to control appetite. So if GLP-1 is not going up like it should, then you can continue to gain weight and your diabetes can progress. So what we're doing here is we're taking semaglutide in the form of Ozempic to stimulate those receptors, to take into account and actually go beyond what the normal human hormone would be doing, so that we can control diabetes by increasing insulin secretion from the pancreas, but also inducing weight loss because your appetite is controlled by those two methods I just described, decreasing the speed of your digestion and decreasing appetite in the level of the brain. So that is how Wegovy and Ozempic work. Basically, most people are able to take these medicines. There are a few very, very rare conditions with the thyroid that make this kind of a risk-benefit discussion. Those things are very rare and very unlikely to be in the family history, but we ask about them. The main side effects of these medicines, because they slow down gastric emptying, are constipation and nausea and general stomach upset. There are 6 dosing levels, so that allows us to start low and go slow. We only go up in the dose each month if the patient is tolerating it. We can often ameliorate those symptoms with good hydration, lots of fiber in the diet, additional fiber in the form of gummies or a fiber powder. And if it's really a big issue with constipation, we can try some Miralax. Really a pretty well tolerated medicine, especially if we go up slowly on the dosing, as we always do. And we don't need to get to the maximum dose in order to get a lot of effect. There is, basically weight decreasing rapidly and then not quite as rapidly as you get up to the 5th and 6th doses. So if the patient doesn't tolerate those effects on the gut, then we can basically be happy with the fact that they're on dose 3, dose 4, and losing a significant amount of weight, because the upshot, what everyone wants to know, is on average about 15% total body weight loss with a medicine like Wegovy. So let's move on and talk about the newer kid on the block, which is something of a blockbuster medication, even more so than Wegovy has been, because it induces more weight loss typically, and that is Zepbound. So Zepbound is the FDA approved version for weight loss of a compound called tirzepatide. Tirzepatide first was FDA approved, similar fashion to Ozempic, as an anti-diabetes medicine in the form of Mounjaro. Tirzepatide first came out as Mounjaro, controls diabetes well, and actually causes up to, or even in excess of 20% weight loss in 30% of people in the studies. So most of the time we see around 20% or more weight loss with Zepbound. Do bear in mind that for both of these medicines, there are maybe 5-ish, 10-ish percent of people who are non-responders for whatever reason. We don't know exactly why, but they simply don't lose weight with these medicines, and we need to try other means, and always, always, always lifestyle change as the foundation. This particular kind of medicine, tirzepatide in either form, is a dual agonist medicine, and so that's medical jargon for it. It works on stimulating 2 receptors. So the GLP-1 that I mentioned a minute ago for semaglutide, but also another one called GIP, which is glucose insulinotropic polypeptide. That's why we call it GIP for short. It's a mouthful, no pun intended. So tirzepatide in the form of Zepbound, FDA approved for weight loss. It tends to cause less in the way of GI side effects, maybe just a touch of nausea in some people in the early time of starting the medicine. It appears to be that if we stimulate both the GLP and the GIP receptors, there's simply less in the way of GI side effects. So not only is it more potent with 20+% weight loss, as opposed to the 15 or so percent for Wegovy, but it seems to have fewer side effects. So it's my go-to medicine for people who are able to take it and who also have insurance coverage, often the big hurdle here. However, it can be paid for cash. There is a manufacturer's coupon that does cut it to 50%, but it's still an inexpensive monthly medicine for you if it's not covered by your insurance. Bear in mind there are always other options, and certainly consider making an appointment with us. Come in and see me if, for example, your insurance does not cover any weight loss medicines. That's not an uncommon problem that I see. An unfortunate thing, but the insurance companies and a lot of people in general still view weight management and obesity as a cosmetic issue and a matter of willpower in the patient. And at a certain point, neither of those is true. We can get into the hormonal things that affect people's difficulty losing weight when they get to a particular BMI on another video. But suffice it to say that at a certain point, at a certain BMI, different for everybody, but it no longer becomes about willpower due to derangements in the hormones that regulate appetite. So unfortunately, there are insurance companies who don't see the benefit in weight loss, because I look at weight loss as the mother of all the chronic metabolic problems in the country: hypertension, diabetes, high cholesterol, and thus all the things they can lead to, like heart attack, stroke, peripheral artery disease, kidney disease, liver disease, cancer, you name it. All affected by obesity and really kind of downstream effects of having too much adipose tissue. So management of weight is not just a cosmetic problem. Obviously, people would like often to look thinner. There is unfortunate bias in society against people who are heavy. But there is true metabolic disease, and obesity has since 2013 been considered by the American Medical Association a chronic disease, just like hypertension. And so we treat it that way. Ideally not to have people on medicines forever, but just like hypertension, if I control somebody's blood pressure with blood pressure medicine, and the only way that they're ever going to get off the medication is with significant lifestyle changes, because as you would expect, if they don't do those kinds of things in a strict way and lose weight as well, then they're likely to just have their blood pressure go back up if we stop the medicine. So always lifestyle, and it takes very vigorous lifestyle changes to basically either taper the medicine to a lower dose or to get off it entirely. It does take work, but we have all those programs in place here to help with nutrition, to help with exercise. I do individualized nutrition and meal planning with my patients. We have an exercise physiologist who works with our patients for that pillar of lifestyle, and we have a health coach on site, Irina, who's you may have seen in our most recent video talking about the benefits of health coaching. So we offer a very comprehensive program here. I use medicine whenever needed, and the patient is open to the idea and able to take or obtain the medicine. So those two blockbuster medicines, Wegovy and Zepbound, real game changers. They can be excellent tools to utilize in our toolbox, but they are not substitutes for all of the lifestyle changes. For more information, please feel free to reach out to us. You can peruse our website at northeastmedicalpractice.com or call the office to speak to us, 516-604-3418, and hope to see some of you in clinic and basically give you some help and set you on a much better path toward health by managing weight. Okay, take care. See you soon.